Congratulations to the University of Rwanda's Regional Center for Excellence in Biomedical Engineering and e-Health on being designated as a WHO collaborating center for WHO-FIC. A first for Rwanda and only the second in the WHO Africa region. This is a proud milestone for us all. It signals Africa's growing capacity for leadership in health information systems. The WHO family of international classifications is a tool for countries. It strengthens health information systems, reduces costs, improves disease tracking, and saves lives.
Yes, so actually this has been a journey for the University of Rwanda Center of E-Health and Biomedical Engineering. We have been working as WHO with the center mainly since 2018, 2019. This is a center which deals with what we call the family of international classification of diseases. So it's got three aspects. One, what we call ICD is the international classification of diseases. And then there is the international classification for disability in health, functioning disability and health. And then the other part is international classification of health interventions.
So regarding how the academia can support the use of classifications in the country, I would see it in three folds. Number one, the academia has its own mandate to serve the nation in three aspects. One, in research. Number two, in services to the community. Number three is more on training.
I mean, in terms of ICD-10 implementation in the past, I mean, we had the challenge of the human resource. I mean, we didn't have enough coders. I mean, just a few coders, and we were coding centrally, and the data had to be brought to the center, then it's coded. So that was a big problem for us. And in terms of, I mean, even the completeness of this, so it was basically manual. So there was no technology involved. The data, I mean, the medical certificate of cause of death was collected from down, I mean, the hospitals and brought to the national. And we are not even using the standard medical certificate of cause of death. We were using, I mean, one of the old ones, and that also presented a lot of challenges in terms of, yes.
And now we are able to use ICD-11 by integrating the ICD-11 coding tool into our electronic medical records, and the doctors themselves are using that, and this improves the quality of recording our diagnoses at discharge.
One of the reasons why we are gathering here is to look specifically at coding causes of death and to produce high-quality mortality data.
What we mean when we talk about the WHO family of international classifications, these are data standards which enable countries to speak the same language and understand each other when they are making references to diagnosis of diseases, of health interventions, and of disabilities.
Eswatini was using ICD-9, and it had quite a number of challenges, starting from the book itself. You need to peruse the book to find the relevant codes. That was the first part. The second part was that our coders were non-clinicians, so some of the codes they wouldn't really know.
The challenges we face concerning implementing ICD-11 fully is that staff, although the ICD-11 training is available online, they prefer one-on-one approach, where the trainer is in front of them and then teaching them how to work with the ICD-11. But just like we have learned during the sessions, that it is so simplified that it's just like a Google search. I think those getting acquainted to the new way of working with ICD-11 is something we need to embrace and let the staff be comfortable with.
The International Classification of Diseases, 11th revision, has basically three important new features. The first is that, of course, it is containing a lot of information which is clinically up to date. The second innovation we have in the ICD-11 is that for the first time we have incorporated into a classification medical terminology. So that makes the whole classification and the task of coding with the classification much more clinician friendly, user friendly.
We do have some very good examples of countries that have really advanced in the implementation of these classifications. Namibia is one such example. Burundi is another good example where these classifications have actually been integrated in the electronic medical record systems. Also, this country we are in right now, Rwanda, has actually adopted ICD-11 as a reference classification for coding diagnosis of diseases and of the causes of death, and they are in the process of also integrating the other classifications like the ones for health interventions.
Yes, so it was really important to include the digital open rule integrated course of death selection workshop, because this will help us to improve health information standards. Now, the DORIS 2, the digital open rule integrated course of death selection, is a software which has been developed by WHO together with countries and together with the WHO family of international classifications to be able to identify the underlying cause of death. So this tool is an automated tool which allows using the ICD-11, the newest, the 11th International Disease Classification System, to automatically look at death certificates. So the death certificates, of course, they have to be scanned and put in a digital form, and then it's then able to identify the causes of death from the death certificate. And this then will be very critical, because we are then able to fully understand what are the underlying cause of death. That's important, because once we know exactly what the actual cause of death is, we are able to develop the right programs, the right policies. We are able to ensure that the resources are provided, so the resource allocation is then more focused, and therefore the programs are much more targeted. So DORIS is really very important for everyone to understand, and that's why this workshop is very key, because it then allows us to fully understand the causes of death. So at the end of this workshop, we're also expecting that country teams would develop a roadmap which will integrate DORIS into the member states' ICD-based systems for certifying cause of death. And this way we are then able to make sure we have a coordinated approach to improving health information standards.
Special thanks to all our partners that have made this possible. Vital Strategies, the Bloomberg Data for Health Initiative, the UN Economic Commission for Africa, UNICEF, the Africa Centers for Disease Control, the Gates Foundation, the Global Fund, Team Europe Initiative, the Swedish International Development Cooperation Agency, and the Susan Thompson Buffett Foundation. Our collective task is now to move beyond development to implementation. Tools only have impact when adopted, used, and sustained.